Hi, everyone. We'll get started in a minute or two here. So for our speakers, I'm going to give a little introduction and then about Catalyst and how the questions are going to work out. They'll be in the chat. And I don't know if Professor Cole mentioned that he's going to, about the timing. Did you talk about that?
I did.
Okay, excellent. And then we will get started, but we'll wait till maybe 11:01 just to give people some extra time to get in.
And you guys have played with the share screen thing?
Great. We'll give another minute or so to get people in. As people are often switching rooms, so it sometimes can need to catch up with technology here. All right, we will get started. Hello, everyone, and welcome to our third Catalyst 300 presentation of the day. And we have four separate sessions going on. If it's your first time joining us, this is our Catalyst 300 presentations. These are an applied innovation class that are looking at a big problem and trying to find a solution to it and propose an innovative solution to it. And our format of the day will be that our speakers will give their presentation, a 20-minute presentation, and then the questions will be submitted through the chat function. So if you have any questions, Mark Cole, who's from the Exercise Science Department, is our co-host of today, and he will be moderating the question and answer session. So if you have questions, you can submit them in chat at any point during the presentation, but they'll be addressed at the end of the presentation. And we'll have time for a few questions at the end. With that, I'd like to have our speakers take over. They're going to focus on women and children's health is their challenge. And their title is African American Women's Healthcare in Milwaukee, Wisconsin. So with that, I'll hand it over.
Thank you. All right. Good morning, everyone. Thank you so much for joining us to talk about women's and children's health care in the context of prenatal and perinatal care in Milwaukee, Wisconsin. My name is Hannah Olson.
My name's Suzanne Day.
I'm Noah Harriet.
I'm Hunter Simmers.
And I'm Casey Weingart.
So our goal for women's and children's health is to increase the awareness and availability of prenatal and perinatal health care for African American women in the Milwaukee area. This health care is important to monitoring the full-term development of the baby and ensuring safety during the delivery process. This care needs to be increased in Milwaukee for African Americans because of the high rates of low birth weight and preterm births within the population. Hunter will now tell us more about the harms and significance of this health care.
Concerning the significance of our problem, we decided to highlight 3 areas where African American women are facing complications during the pregnancy process. First of which is discrimination. Many studies have been done where they recorded firsthand experiences of these women who identified 3 major areas of perceived discrimination, mostly based on insurance or income status, race, and lifetime experiences of racial discrimination. So these women described being treated differently by support staff and providers based on type of insurance, describing a correlation of lower quality of care at clinics that accepted public insurance. African American women with limited incomes also perceived many provider practices and personal interactions during prenatal care as discriminatory. And the majority of women described experiences that fit within the definition of institutionalized racism, where the system was designed in a way such that it worked against their attempts to get quality prenatal care. Next aspect we chose to look at is the complications African American women face during the perinatal stage. First off, to define the perinatal stage for those that may not know, it is defined as the weeks immediately before and after birth. So some barriers for African American women obtaining perinatal care included transportation insurance, negative attitudes towards perinatal care, perceived poor quality of care, unintended pregnancy, and psychosocial stressors. Nationwide, African American women report higher stress levels and less access to pre and postnatal resources, which lead to possible complications like the mother and infant mortality rate, as the risk of African American mothers dying during childbirth is actually 3 to 4 times higher than white women. Going off of this, Wisconsin mirrors national infant mortality trends that show a persistent 4-decade gap in infant survival between African American women and white populations. Finally, African American women struggle with preterm births. African American women account for having 60.5% of all preterm births within the United States, which is considered anything under 37 weeks. They also experience 64.8% of low birth weight births, considered anything under 5.5 pounds. Being born preterm has complications in and of itself, with those that were being born preterm can suffer complications that affect their growth later in life, as well as potentially causing blindness, cerebral palsy, hearing impairments, and mental retardation. To bring everything all together, maternal perception of exposure to racial discrimination during pregnancy may be associated with very low birth weight in their infants. Now, Noah will take over and talk about a couple previous solutions.
There's 2 previous existing solutions that address pregnant women's lack of access to healthcare. The first is the California model. The California model was designed to increase access to risk-appropriate healthcare for pregnant women. The California Department of Public Health created manuals on pregnancy-related complications and how to reduce C-sections in an attempt to prepare all practitioners for these complications. The model also includes increased emergency drill training. The goal of this was to increase the practitioners' efficiency and skills in high-stress situations. This model has shown to decrease the maternal mortality rate in the state of California. A few issues with this model are practitioners would need additional training, funding may be difficult to find, and conflicting ideals in other states may prevent the model from being implemented. Another issue is the time needed to create and ship the manuals where they need to go. The next solution is by Ascension St. Joseph's Hospital in Milwaukee, Wisconsin. They created a plan for pregnant women to have access to healthcare they need. The components of the plan consist of connecting pregnant women with programs that allow them to purchase prescriptions at a reduced price, increasing transportation availability to patients who need it by coordinating transportation options, connecting uninsured individuals to low-cost medical insurance, and connecting patients with a primary care provider. Ascension St. Joseph also created an emergency department designed specifically to care for pregnant women. It's staffed with nurses, physicians, midwives, and 7 OBGYNs. The department was created and staffed in this manner to decrease delays, wait times, and decrease the infant mortality rate. It's open 24 hours and located near areas of Milwaukee where the infant mortality rate is one of the highest in the country. Another program connected to the emergency department is the Maternal Health Initiative, which provides pregnant women with food or supplements based on the nutrients they're lacking. For example, if they're iron deficient, they would be provided canned chicken or other foods or supplements high in iron. A couple issues include the approximate $1 million increase annual cost for the emergency department. Another issue is it can be difficult to connect with pregnant women who need transportation if they do not have cell phones or have limited calling minutes. Casey will now talk about our solution.
The solution that we are proposing is a nonprofit educational center in or near low-income African-American neighborhoods in Milwaukee, Wisconsin. This center will be called the Center for Mothers and Children's Health. The center will provide mothers a free consultation with immediate access to resources, enrollment in health insurance, and connect these mothers to health care best suited for them. In addition, our center will also be offering counseling to mothers who request it. There is a center that is similar, Seed of Hope in West Bend, Wisconsin. However, this center is out of the way for our Milwaukee mothers. Also, some mothers may not feel comfortable with Seed of Hope as it is a religious organization. Center for Mothers and Children's Health is a secular organization, meaning that all mothers will feel comfortable within the walls of our center as it is non-religious. As for the location of the Center for Mother and Children's Health, we will be focusing on placing it within the northern central part of Milwaukee. When looking at the map on the screen, it can be seen that the northern central Milwaukee is the area of the city where there are more lower income families. This will make CMCH more accessible for these mothers to get their first consultation on their own. CMCH is going to be a center for resources and utilization of our staff instead of a clinic, so that it will be more cost effective to run and the surrounding hospitals and clinics can be used. Talking more about the location, we have found an ideal office space to run CMCH out of. It would be the first floor of the Shafi Plaza, as this is office space instead of a medical clinic. This would be an ideal location as well because it is within our targeted region of Milwaukee. There is the then clinic space above our floor that we could take advantage of for basic care for the mothers. This building is easily accessible as it is crossed by 3 city bus routes. As for expenses of the building, it would be the initial cost of $1,399,000, which would be cheaper than leasing it year by year. It is important to differentiate what sets us apart from a clinic like Planned Parenthood, which there are 7 of in the area. One major thing to help control the costs for the mother and the funding that CMCH will be needing is to enroll mothers in state insurance. Another way that we help with the cost of appointments for mothers is through our discretionary fund. This would act as a 0 interest rate loan that mothers could pay back within their own time with a minimum payment of $20 a month for costs of insurance that were not covered. This would help to keep new mothers out of medical debt that would later hurt them if it went into collections. Comparing this payment to Planned Parenthood, women are often left with a decent payment needed to be paid after the visit that they are responsible for. Another way that CMCH is set up apart is through the staff and training that they receive. Staffing will go through unconscious bias training and be held accountable to follow our no discrimination policy. Mothers will give feedback through a survey after each interaction with our center to make sure that they are receiving the care that they are promised. Advocates are the most crucial part for CMCA to be successful. Advocates are people that assist the mother at their appointments and make sure the mother is being cared for properly. They are different to doulas, which are commonly used by mothers in the birthing. Doulas are there for the birthing process as a support team, whereas our advocates will be there for the mothers throughout the entirety of their pregnancy. Advocates provide transportation to the women who are unable to get to the appointments on their own. With giving the mothers a way to attend their appointments, this means they are getting the care that they need on a regular basis throughout the duration of their pregnancy. Another aspect that advocates take care of for the mothers is reviewing their medical bills. This is to ensure that the billing to the mothers is correct and they are not being overcharged. According to economist Kelly Gooch, 80% of medical bills contain some sort of error, and by having someone review the bills, this will prevent the errors from being in the hands of the mothers. The most important thing that advocates do is attend appointments with the mothers. This is so that the mother is able to have support throughout the appointments and communicate to the physician when the mother does not feel comfortable to do so. Our idea is not for the advocate to overshadow or talk for her, but to step in when necessary to make sure the mother is receiving the care she should be receiving. As for the training and hiring process of the advocates, CMCH will be looking into hiring social workers or people who no longer work in the medical field. This is because they know how an office or medical clinic should be run and know what is correct to do in a situation where the mother needs more support than the physician is giving her. Advocates will all go through unconscious bias training to know how to care for the African American Black mothers. Hannah will now talk about our budget.
Our budget will include the building costs and utilities, transportation costs, employee compensation, and our discretionary fund. As Casey mentioned, the building will be a one-time cost of $1,399,000. The taxes and utilities will continue to vary depending on the length of time and the length of use, and those costs will be continuously addressed during the time in the clinic. Transportation costs will include public bus fares and gas reimbursement for our advocates. The typical bus fare that will be used will be the all-day adult pass, which comes to $4. Other bus passes are available for people who use the buses more often or who qualify for special passes. Our advocates will help match women with the best pass for their needs. If our advocates are doing multiple days in a row, there are 7-day and 30-day passes that average out to a lower cost that would be more effective for our center. Transportation costs will also cover full reimbursement for gas used in personal vehicles driven by our advocates. This is not the transportation that we want to be using most often, but if a bus route does not pass the location that our women need to be taken to, our advocates can drive their personal vehicles, and any gas use during business hours will be reimbursed to those advocates. Compensation for employees will also be included in our budget, and the compensation that we'll be offering is a daily flat rate for our advocates of $200, and then a minimum hourly income for our center staff. And at this time, minimum wage is $7.25. And then since CMCH is a nonprofit organization, any other income that we have will be put into our discretionary fund, which Casey talked about a little bit. It's our low no interest loan that we can offer to women if it becomes necessary. And Suzanne will now talk about our funding and donors.
So for funding and donors, grants, Planned Parenthood funding, silent auctions, billboards, and social media will be our main sources. The main grant we want to focus on applying for is the Momentum. This fund, this is a fund that helps with maternal and newborn healthcare, among other health services. The maximum amount available is $5 million. The Street Outreach Program is another grant we are able to apply for. The fund helps with homeless, street youth, and runaways. This is available to nonprofit organizations like ours, and the amount of money available is between $90,000 and $150,000. Along with grants, Planned Parenthood funding is available. Title X goes along with this funding. Title X provides affordable reproductive health care to people with low incomes. Since CMCH provides access to wellness exams, Title X will fit into this funding. Silent auctions are another way to cover our discretionary fund for CMCH. A dinner will be provided, either made by staff or donated from a restaurant. Silent auction items will be donated from local businesses. This fundraiser will be prospected to happen every spring and fall. We believe this event will not only help with funding, but also provide a close connection to our community. Billboards and social media are the last two ways that we believe will help contribute to funding. Billboards can be expensive, between $2,000 and $3,000 per 4-week period. However, with the right placement, preferably on Interstate 41 when entering Milwaukee, we will be able to advertise our services and find donors. Social media, on the other hand, is a free resource to receive donations and let Milwaukee residents get to know what CMCH is. Potential barriers include funding, staffing, and time. Funding barriers include ways to advertise and donors themselves. Funding is time consuming, and our program depends on it if we are able to get this funding. Staffing is another barrier because along with time, we will need to find volunteers for CMCH, which can take 1 to 3 months, depending on how quickly people apply. After we find staff and volunteers, it will take time to train everyone on the proper procedures. And Casey will wrap us up.
At the Center for Women's and Children's Health, we will be able to strive for the healthiest pregnancies within our mothers who come to us seeking help. The mother will be heard and given the care they need. The mothers will also be able to get to their appointments to receive the care that is essential during pregnancy. By caring for the mothers in this way, there is hope of lowering preterm births and rising the birth weights among African American and Black mothers. Thank you for listening to our presentation. Are there any questions?
All right, thank you. So we are going to open it up to questions. If you joined us later, we are going to do our questions through the chat. So if you have questions, please put them into chat, and Professor Cole will moderate that. And I will give you a second to put some questions in. Are there any that you've seen so far?
No, not yet.
Okay. Well,
Great job. Good.
Yeah, I have a question to get us started. You mentioned that the advocates could be driving the people they're working with to different places if the bus lines weren't available. So does this mean that all advocates would have to have access to their own personal vehicle? And did you consider having a center vehicle as something that you would have either in the future or something that you would have as you get started?
Yeah, so we're not requiring any of our advocates to utilize their personal vehicles. However, we will have advocates who will be trained and certified to be using personal vehicles. So if a mother is paired with an advocate who has chosen not to use their vehicle or is not certified with us, then we would pair them with a different advocate for that day. But the goal is to use primarily the public transportation. And with public transportation, we do have access to freeway routes if that becomes necessary.
Okay, one question in. Is there research that shows a significant return on a $24,000 a year billboard budget?
So unfortunately, we weren't able to find a lot of research on it. I understand that the numbers are kind of weird with that. We weren't unfortunately able to find that, but what we're looking for is more of donors as well as basically getting the word out there of like what our program is, and along with as many donors as we are able to get.
In follow-up, is there a chance instead of a billboard that you might use alternative forms of advertising in a city like that?
Unfortunately, we didn't get to the research, but I'm sure there would be other ideas. So maybe it's, smaller billboards in low-income areas, or because we understand that the billboard specifically is right like on 41, and not necessarily everyone can see it if they work in Milwaukee. but just trying to find a bunch of other ways to advertise our services as well as get funding.
Okay. Do you imagine formal or informal partnerships with other organizations? Or let me elaborate. Can you maybe characterize those relationships and partnerships that you were thinking about?
We're talking about with like bringing them to other hospitals and stuff like that, correct?
Well, any organizations that are going to assist you with your mission.
I think they would, for hospitals and clinics like that, it would be more of an informal basis, as we'd go in when the appointment was needed with the mothers, versus like when we're talking about maybe putting up a silent auction or something like that, advertising within restaurants, anything like that, that would be more of a formal thing because they would be providing for us.
Okay. Another question came in about the compensation and the wages for staff. So $7.25 an hour for 8 hours is $58 a day, as opposed to advocates making $200 a day. Can you maybe talk about the difference there?
So with our advocates, they are getting paid more because sometimes appointments can last a really long time, or they can last 15 minutes. It just depends, but they are the ones who have had the previous medical experience, or they are working like as a social worker, as we stated before. So that means they are often more qualified versus the staff just works in the building. So they don't leave, they don't have to use their cars if they chose to or anything like that. So it's more so a volunteer / non-salary position.
Okay. Other questions, anyone?
I have a question.
All right.
Were you considering benefits at all for any of your employees? Was that $200 a day in addition to benefit, or would benefits be included, or and will those staff people have benefits, or was this without benefits?
So being a nonprofit organization, we weren't looking into doing any benefits at this time, just because we're not sure what kind of income we are going to be able to have. In the future, if it does become a very successful business, we would like to have full-time salary employees in the center. And then if we ended up getting to that point, we would offer different benefits for that, depending on where we are as a center and what would be the best benefits to be offering to our employees.
Thanks.
I think that's pretty good.
Are there other questions from the audience at all? All right. Well, if there are no more questions, I'd like to thank everyone for joining us. We have another presentation that starts up again at 1:30. So I encourage you to join us for some more presentations from other groups in Catalyst 300 in the afternoon. And thank you so much for joining us, and great job, guys.